Well, hello, everyone. I'm Judy Heaster. I'm with the Medicare SHIP program in Northwest Colorado, and we're here to give you all a general overview of Medicare. We could spend probably a half an hour on every slide I'm going to talk about, but this is, in fact, a general overview of Medicare, and hopefully you'll feel a little bit wiser when we're all done with this. We will be taking questions periodically, so feel free to be writing those down or taking notes so that you can ask whatever questions you have later. And with that further said, I will go ahead and begin the presentation. And thanks to Casey's Pond, who's helped us to organize this and provide a virtual platform for us to do this. So as I mentioned just a little bit ago, I am part of the SHIP State Health Insurance Assistance Program Network. I wanted to assure you that we don't stand alone. We are very closely affiliated not only with the Centers for Medicare Service and the Colorado Department of Regulatory Agencies, but we work very closely and under the Area Agency on Aging in Northwest Colorado. Work closely as needed with Social Security, the Railroad Retirement Board, and the Senior Social Center over in Craig. And I understand we may have a few people with us from the community center here in Routt County now, and welcome. We're happy to have you all with us. All of us, like me, who are regular counselors with the SHIP program, are volunteers. We are trained and certified and give of our time to help you so that you can navigate the pathways of Medicare more comfortably. So as you begin to research Medicare options, there are some things that I think are really important for you to keep in mind. Do keep notes. Keep track of names and dates, contact people that you speak with, important points that they make or important questions that you have. Do be sure to read any mail that's coming into you very carefully. Yes, some of it is marketing material. People find out you're turning 65. They want you to purchase their plan, but sometimes within those mailings, you can be getting some actual stuff from Centers for Medicare Services or Social Security, and we don't want you to overlook those. Do keep copies of any paperwork that you generate in terms of applications to Medicare or for drug plans or things like that, just in case it would become important for you to be able to validate where you are in the process of your application for Medicare. And do date everything. Not everything that you get from Medicare has a date on it, so put a date on it when you get it. Do make sure you know who you're talking to. Beware of fraud. If you're getting phone calls, remember that Medicare would never ask for you for any personal information, Social Security numbers, anything like that. So anyone that would start doing that with you over the phone is someone that you should stay away from. And do remember too that it's a very complex topic, and your individual situation is unique. It's not necessarily the same situation that your best friend down the street or your relative in a different state is going through. And so you want to discern that you're learning the best information you can, so you make a decision that's going to best meet your individual needs. And that's where I think we as SHIP volunteer counselors can perhaps be very helpful to you in this process. We're local, we're available through the SHIP line, and that line is listed here, and you are welcome to call us with your Medicare questions, or if you feel you want assistance with your process in applying for Medicare. So now my screen is frozen, so we'll figure out why that's happening. There we go. Okay, so what is Medicare? Let's discuss that for a minute. It is a federal program established back in 1965, And it does provide health insurance for people, citizens within the US and US territories. If you're 65 or older, if you're under 65 and deemed disabled by Social Security and have met your 24-month waiting period. If you are suffering from ALS or Lou Gehrig's disease, and there's no waiting period with that, so that would happen anytime in your life. Or if you have end-stage renal disease, where Medicare will kick in as a secondary payer. Medicare does help with the cost of health care, but do remember that it does not cover all of Medicare expenses or the costs of most of long-term care. And that's often why people who pick up Medicare Parts A and B will also pick up drug plans to cover prescription medications and supplemental plans to help with the parts that Medicare doesn't cover. Another way that happens is for people who have access to and can pick up Medicare Advantage plans instead of the Part D and the supplemental. Medicare generally pays 80% of your medically necessary charges if those services are provided by a Medicare provider. And that's an important piece to remember. And we'll talk about it a little bit more. There are 4 different parts of Medicare, and then kind of a 5th affiliated part that we'll talk about. Part A, which is your hospital insurance. Part B, your medical insurance. Part C are these advantage plans that I just mentioned, of which we have very few here in this part of the state. And then Part D, which is your prescription drug coverage plans through Medicare. And then those supplemental plans that I was talking to you about, sometimes referred to as Medigap plans, work cooperatively. They're organized by private insurance companies, and they work cooperatively with Medicare. So the very first thing you have to decide is how you want to get your Medicare. And if you take a look at this little chart that I have here over on, there's basically two options. When you get ready to enroll in Medicare, you'll enroll in Part A and Part B. And if you decide that you want separate drug coverage, you would enroll in a Part D prescription drug coverage plan once your Medicare card has come through and you have a Medicare number and everything. And at that point, you can also enroll in a supplemental plan that would help to cover that 20% of hospital and medical charges that Medicare is not covering. Or if you have access to a Medicare Advantage plan, which is the Part C piece of Medicare, you would enroll in Medicare Parts A and B. And usually with a Medicare Advantage plan, that's covering both some or all of the supplemental, the 20% that Medicare doesn't cover, or and it's also giving you some assistance with prescription drug plans. Different Medicare Advantage plans cover it at different levels, as do straight Part D and Medigap plans. They will, some cover more or less than others, depending on the plan that you pick. So what is original Medicare? It's a term that's thrown around a lot, and I think it's important that you get kind of accustomed to that. Original Medicare is comprised of both Part A and Part B. Part A being that hospital insurance, which covers 80% of your inpatient hospital coverages, some skilled nursing facility care, home health care, hospice care, etc. Part B of Medicare is your medical insurance, which will be covering up to 80% of your doctor visits, outpatient hospital and clinic services, clinical lab tests, durable medical equipment, preventive services, things like that. Do remember that Part A and B plans do not work outside of the United States or United States territories. I want to make sure you're aware of that. So let's first talk about Medicare Part A, hospital insurance. You may or may not be eligible for premium-free Part A. If you are eligible for premium-free Part A, that's because you're age 65 or older, you're a US citizen or a permanent resident, and you are receiving or eligible for Social Security or railroad retirement benefits. So you have a spouse who is receiving or eligible for Social Security, railroad retirement benefits, and you or your spouse has worked 40 quarters or 10 years and paid Medicare taxes. If you've received 24 months of Social Security or railroad disability benefits, you'd be eligible for Medicare. If you have end-stage renal disease, as I spoke of earlier, and meet certain requirements, or have Lou Gehrig's disease, ALS. So premium-free Part A, if you've met those 40 quarters, or your spouse has, and you meet some of these other qualifications. U.S. resident or permanent resident, 65 or older. If you didn't work those quarters, Part A can be purchased. So if you don't have the qualifying work history and you are a U.S. citizen or a permanent resident, you can pay for your Part A. In 2021, if you paid Medicare taxes up 30 to 39 work quarters, you might be able to purchase Part A for $259 a month. If you have a much larger income, there might be a surcharge on that. If you paid Medicare taxes less than the 30 work quarters, you may be able to purchase your Part A for $471 a month. Again, more if you would be surcharged for an extremely high income. And if purchasing Part A, you must also purchase Part B. So let me repeat that. If you end up having to purchase Part A, you must also purchase Part B. Okay? So now let's talk just a little bit more about Medicare Part B, which is your medical insurance coverage. Outpatient, basically. You're entitled to Part B if you're, again, 65 or older, again, a U.S. citizen or resident, or a permanent resident, I should say. You're automatically enrolled in Part B if you're already receiving Social Security or railroad retirement benefits, or if you've been on Social Security disability for up to 24 months, for 24 months, not up to. So the Part B 2021 premiums have been $148.50 a month for annual incomes less than $88,000 per an individual or $176,000 for a couple. Higher incomes may be subject to premium surcharge, and you can appeal that process if you feel you're entitled to a reduced rate on your Part B premium. And the income levels are likely to be higher in 2022. They're not out in black and white yet, but I've read some places where they're anticipated to go up to around 91,000, and then in that case it would be 182,000 for the couple income limit. You can also purchase Part B alone if you're eligible for premium-free Part A, and that would happen if you decide that you're still working, you're 65, but you have good employer coverage. You're not ready to join Medicare just yet, and you could join Part B at a later time when you leave or lose your employee coverage. Questions about Part A or Part B before we continue and move on for a brief discussion of overview of Part D, the prescription drug coverage? Okay, then I'll just move on.
No questions.
No questions so far. Okay. So Part D, prescription drug plans are optional, but if you choose not to sign up when you're first eligible, which is during your initial enrollment period, we'll talk about that down the line, you could be subject to a monthly premium penalty charge, and that usually never goes away. Your prescription drug coverage options: Medicare Part D standalone plans that work with original Medicare Parts A and B. And you
Excuse me, sorry,
no?
we did have a question. We did have a question here.
Uh-huh.
Okay. Do you want to, about WellCare?
Oh, yeah, is WellCare as part of Part B, Part D as in dog?
Yes, it is. Okay.
So, Okay.
But you would need to sign up for a special WellCare Part D drug plan. If you're on WellCare now, that wouldn't necessarily carry over.
uh,
Okay? All right. So as I was saying, the prescription drug coverage options, Medicare Part D standalone plans work with original Medicare Parts A and B. You do have the ability to change plans every year during the annual open enrollment period, which is starting up next week, October 15th, and will run through December 7th. And we as counselors urge you to check your drug coverage plans every year, whether you think you need to or not, because the plans always are changing, and we want to help you and assure that you're always staying on the most cost-effective plan for you if that's important to you. So a little bit more about Part D. To be eligible, you must have Part A or Part B. And signing up for Part D is not automatic. You have to actively enroll in a Part D drug plan in order to obtain one. And those drug plans do not work outside of the United States or US territories. Monthly premiums for Part D plans will vary by location, the prescriptions that you're taking, the drug plan company that you choose, and even the pharmacies that you choose to go to. And those plans can be subject to penalty if you enroll late, as we talked about earlier. And we have and can help you to utilize a plan finder tool that's available through medicare.gov, which makes the process searching for and signing up for a Medicare drug plan much easier for you. So I've mentioned a couple of times that Medicare Parts A and B are covering only 80% overall of your hospital and medical coverage needs. So how do you pick up that other 20%? So we're going to talk about that now. So to do that, I want to first review with you what you're paying for and what is covered in Part A, which is your hospital inpatient coverage. So for instance, if you were hospitalized and you did not have any kind of supplemental coverage, in 2021, you'd be responsible for $1,484 of that hospitalization every 60-day benefit period. So if you somehow manage to be hospitalized every 2 months throughout the year, that could be 6 times $1,484. Does that make sense? If you were hospitalized in January with pneumonia, but you were back there the second week in February with a broken hip, that's within a 60-day benefit period time, and you would only be charged that $1,484 one time. So additionally, you would be charged $371 for every day that you're in the hospital, 61 through 90, within a 60-day benefit period. And then $742 after those 90 days up, which is part of a lifetime reserve that once it's used up, it's used up. So all costs for each day after the lifetime reserve days, you'd be responsible for. And inpatient mental health care in a psychiatric hospital is limited to 190 days in a lifetime as well. So in terms of skilled nursing facility care, there would be no charge for the first 20 days. There would be a charge of $185.50 per day for days 21 through 100, and then all costs for each day over 100 would be your responsibility. Home health care, again, no charge for home health care services, but usually a 20% of the Medicare pre-approved amount for durable medical equipment. So that kind of gives you a little bit of a rundown on what you pay with Part A, if you have no other supplemental coverage. Part B covers approximately 80% of all of the following services and others, but these are the main ones listed here. Doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, diabetic testing supplies, outpatient mental health services, and some preventive services. Some are covered in full. Some preventative services are not covered in full. As I mentioned earlier, currently the premium is $184.50 a month. And with all Part B, there is a deductible of $203 a year. In other words, you would pay $203 out of pocket first before Medicare is going to kick in and start paying 80% of your costs. So let's talk just a minute about Part C. If you have the opportunity to be part of a Medicare Advantage plan, and right now here in Northwest Colorado, the two that I am most aware of are both national Medicare Advantage plans. One is through Colorado Public Employees Retirement Association, and the other through the federal government. Those are the two that I'm aware of, although we hear there are some Advantage plans, or at least one or two that may be coming into our area soon. We don't know exactly when. We may know more in the next week or so. But Part C Medicare Advantage plans usually cover prescriptions as well as additional hospital and medical coverage, and cover some or most of what Medicare Parts A and B don't cover. There may be coinsurance and deductibles and co-payments that are also associated with your Medicare Advantage plan that you would always pay out of pocket. And some have the ability to change plans and give you the ability to return to original Medicare if you're dissatisfied with your Advantage plan and then want to try to change over to Parts A and B with a separate drug plan and a separate supplemental plan. So that's how Medicare Advantage plans in a nutshell work. So, one little bit of information just down here in the bottom of the screen in your lower right. If you join a Medicare Advantage plan, you can't use or be sold a supplement plan on top of that. So it's one or the other. So a little bit more about Medicare Advantage plans. They contract with private insurance companies to administer Medicare. You have to have Part A and B, and of course, in most cases, you'd be paying a separate Part B premium. You must continue to pay those premiums in order for the plan to stay in effect. There may be a monthly Medicare Advantage premium as well, but it would be inclusive of some medical and prescription coverage. In most cases, you have to use the plan network doctors or hospitals. And that can become tricky. Many Medicare Advantage plans are somewhat area specific plans that have limited service areas and networks, but they do make allowances for urgent care and sometimes other care needed when you're outside of the network. National plans partner with national insurance companies and national service networks, but again, that's within, even at the nationwide level, it would be who those particular national insurance companies have contracted with for services. And they may include some form of foreign travel coverage and and you have to enroll during the plan's approved enrollment period, and or Medicare plans approved enrollment period. So there are some limitations that you need to be aware of with those plans. And I have something that's popped down on my screen. I'm trying to figure out if I can get it off, because is it blocking your view of the slides right now?
Nope, it's not blocking anything.
Okay, good. All right, good. So we'll move on then to Medigap. And enrolling in Medigap, you first would need to enroll in Medicare Parts A and B. That's the original Medicare part we spoke about earlier. Then you have the option to add the drug coverage. and then the option to add a Medigap plan. Okay. So what is Medigap? It's supplemental insurance that helps to fill some or most of that 20% gap in original Medicare coverage. It too is sold by private companies. It helps to pay some or most of the remaining 20% of those costs, as I said. Will pay for hospital care and medical services. It too involves co-payments, co-insurance, and sometimes deductibles. It pays after Medicare, so it's secondary coverage, whereas Medicare Advantage plans administer the whole billing process. It's a little bit different with Medigap, where it acts as a formal secondary coverage plan. And it may include some form of foreign travel coverage. And that might be important to you because, again, the whole plan as you can use it in the United States would not be available to you, but this special foreign travel coverage would be if you're traveling overseas. So a little bit more about Medicap. You have to have parts A and B, and the best time to enroll is within 6 months of your Part B start date. There are 8 different approved plans available for purchase from any insurance company that's licensed within your state to sell Medigap to you. And you can pick a plan you can live with and should pick a plan that you can live with, because you may not be able to change plans once you're outside of your initial enrollment period. We're going to talk about initial enrollment periods in a little bit more detail, but that is the time period when you have guaranteed issue and a private insurance company has to accept you and sell you a plan no matter what your health conditions might be. It's also important for you to know that it's illegal for someone to sell you a Medigap policy if you have a Medicare Advantage plan. So that works both ways when we talked about that with Medigap Advantage as well as Medicare Advantage as well as Medigap. Now, this particular slide is showing you the various plans, the 8 different plans that are available and approved by Medicare to be sold for supplemental coverage by private insurance companies. What this means is that Medicare oversees what the plan covers, and no matter which private insurance company you go to, a plan A is a plan A is a plan E, a plan M is a plan M is a plan M, no matter if it's Aetna or Anthem or Ascendo or Physicians Mutual. What Medicare has no control over is how much the private company can charge you for that plan. So not all plan A's will have the same monthly premium, nor will plan M's or G's or N's or any of them. If you're interested in your own version of this table in a larger form, you can get that by calling us at SHIP. They can refer you to me and I can send you out a copy of this, or perhaps I could work with Melissa and she could have it available if you all wanted to get it through her. But it's important for you to understand that you have choices. But as you look down through here, notice that not all of the plans cover everything. That's why I say some or most when I talk to you about Medigap plans or Medicare Advantage plans. And notice there are a couple of plans here that have out-of-pocket limits, in which case you're going to have to pay out that much annually before the plan's going to kick in at 100%. So now that you have a basic overview of the various parts of Medicare and what options are available to you for prescription and supplemental coverage, let's talk a little bit about the enrollment process. So there are times when enrolling in Medicare is automatic and you don't even have to, and that is enrolling in parts A and B are automatic and you don't have to really lift a finger. If you're already getting Social Security benefits or railroad benefits, you usually receive a Welcome to Medicare packet 3 months before you turn 65. And you then have the option to accept or deny your enrollment in Medicare at that time. Do pay attention if you're already getting Social Security and the time is ticking away and it's getting closer to your birth month. Follow up with Medicare directly if for some reason or other they've missed you and you're not getting your automatic Welcome to Medicare packet. You have that choice, as I said, to accept your parts A and B, or you can refuse them both, or you can follow the instructions on the back of the card and refuse only part B if you don't need it yet. So for instance, maybe you started Social Security, your husband or wife is still working, or your partner is still working, and you are getting good insurance through them, and you don't need to start up your Medicare just yet. When that spouse, wife, husband, partner either retires or loses their coverage, you would have the same opportunity, a special enrollment opportunity to get on Medicare at that time. So again, it's not everyone is eligible for automatic enrollment in Medicare Parts A and B. In those cases, self-enrollment is required. So, you're not receiving any Social Security benefits, you're not in their system yet, or railroad retirement benefits. What you want to do then is utilize your initial enrollment period before turning 65 by requesting your own Welcome to Medicare packet. And or you can apply online directly through www.ssa.gov Social Security. And we as counselors within your local SHIP team can help you with that piece too. It can sometimes be a little bit challenging to wade through the maze of Medicare, and we're happy to be of assistance to you. So that said, let's talk about what this initial enrollment period actually is. So it's a 7-month window. When you enroll during the first 3 months before your birth month, coverage will start the first day of your birth month. If you wait and enroll the 3 months after your birth month, your coverage start dates are delayed thereafter. So if you waited until the 3rd month after your birth month to enroll, it could be a month or so before your Medicare actually starts at that point. So it's a 7-month window, 3 months before your birth month, and 3 months after. Medicare always, if you enroll early in the early 3 months, Medicare will start the first day of the month of your birthday. So here's an interesting thing though, for those of you who might have been born on the first day of the month, like in this month, it would be October 1st, your coverage start date and the 7-month window moves up a month. It all moves forward a month. So it looks more like 4 months in front, your birth month, and 2 months after. So if you've got one of those birth dates, make sure that you start your process 4 months in advance. So now let's talk again about when to enroll in Medicare. Part A, if you've worked at least 40 Social Securities and paid Medicare taxes, you can enroll in premium-free Part A anytime during your initial enrollment period or after if you don't need it yet, and you can do it during the special enrollment period, which we will talk about. If you don't have enough Social Security quarters, you can enroll in Part A, but there will be a premium assessed. And Medicare Part B and Premium Part A, you must enroll during that initial enrollment period or during other specified limited enrollment times in order to avoid penalties. So the rules are just a little bit different depending on whether you're premium free, you've earned all of those 40 Social Securities quarters, or you have not. So do keep that in mind. And again, a little bit more on when to enroll in Medicare. When you're turning 65 and you have no other or inadequate health coverage, you want to enroll during your 7-month initial enrollment period, your IEP, your guaranteed issue period, okay? Do remember that waiting could result in delays in coverage or penalties to you. And again, enrollment assistance, you can get it directly from Social Security. You can get it by calling the Social Security number there, or working with us through your local SHIP agency or your local retirement board. That's Railroad Retirement Board, I should say. So if you feel you don't need to pick Medicare up during that 7-month initial enrollment period, you might qualify for some very different general and special enrollment periods, which we're going to talk about now for a few minutes. So with Part A, again, if you've got the sufficient Social Security quarters, you can sign up anytime for premium-free Part A. Part B is a little different, and or with premium Part A, either your initial enrollment period or during general enrollment periods that are made available to you January 1st through March 31st annually. And be aware that if you wait and sign up during one of those general enrollment periods, coverage will not start until the following July 1st. And enrollment periods penalties may apply if you cannot show evidence of credible coverage during that gap between your initial enrollment period and when you actually sign up for Part B. Okay, Part A and B, or premium Part A, also have, you can qualify and sign up for those during special enrollment periods, which occur when you leave your employee coverage or your employee spouse's coverage. So that's the piece where, again, you would, with a special enrollment, you would be in a guaranteed issue period. And again, the insurance company would have to offer you coverage, any kind of coverage that you would get without underwriting during those times. Medicare, of course, doesn't do underwriting, but the Medigap plans might. So with special enrollment periods, there's no enrollment penalty if you or your spouse are leaving employee group health plan coverage based on active current employment. You can enroll anytime when you're still covered by that group health plan and you're over 65, or for Parts A and B, within 8 months of the loss of coverage of your current employment, whichever happens first, okay? And note that during a special enrollment period, this is important, the Part D enrollment is limited to 63 days, whereas in an initial enrollment period, you had 7 months to sign up for Part D. During a special enrollment period, you only get 63 days, so you need to move on that pretty quickly. And also be aware that insurance coverages that are labeled as retiree and COBRA coverage are not considered active employment coverage. And with this type of coverage, delays in enrollment will result in premium penalties for your Part B or your Part A if you don't qualify for premium-free Part A. So let's talk a little bit more about Part B and employment. So turning 65 and working with active employment coverage, okay? If there are 20 employees or more, you may want to delay your Part B, especially if you've got good employee coverage, because that employee coverage is going to act as your primary payer and any Medicare coverage that you had would be secondary. But if there are under 20 employees in this organization where you work and you have employee coverage, you do need to start your Part B without delay because it's just the reverse. Medicare acts as your primary and your employee coverage becomes secondary. So there's no penalty if you enroll while you have coverage or are within the 8 months of losing coverage. So this is a time when you're going to want to check with your employee benefits insurance administrator and determine, how many employees are there and whether or not you're going to qualify for, if you're going to continue working, if that primary coverage is that employee coverage is going to act as primary or secondary. Now, without active employment, your healthcare and with healthcare coverage. Delaying Part B could mean higher premiums because of penalties. And during the time you didn't have coverage, you'd be paying for healthcare out of your pocket. And you'd have to wait until the next general enrollment period to enroll in Part B, that January 1 through March 31 time period, knowing full well that it's going to be another 6 months before your coverage would actually start July 1st. So once you're enrolled in Medicare, okay, now that we've actually gotten through all of that, you're going to start getting other types of correspondence. And it's extremely important that you read all that correspondence before discarding. Letters from Social Security and CMS can look like junk mail if you're not careful, and you could be missing important information that you need to make sure that you're fully enrolled in your Medicare programs, your supplemental programs, your Part D programs, or your Medicare Advantage program, and meeting all of the requirements that need to be met, making sure that you're paying your premiums on time, et cetera, et cetera, et cetera. So do read all of your correspondence very carefully before discarding any of it. Questions before we move on? Okay. So just a few little tidbits that I think are helpful for you to know about Medicare. This one is relevant to Medicare and health savings accounts. Many of you may have active health savings accounts right now, but when you enroll in Medicare Part A or Part B, and both of them, you can no longer contribute pre-tax dollars to an HSA. That's a Medicare federal ruling. But any money that you already have saved in an HSA is okay to apply to future medical expenses. So if you are preparing to enroll in Medicare, canceling out of your Medicare health savings, your health savings account is something that you'll need to be taking care of. A little bit about VA benefits, Tricare, and how that relates with Medicare. Medicare is not mandatory for people with VA benefits, but many people choose to enroll. And if you do choose to enroll, all the same Medicare enrollment rules apply, all the ones we were just talking about. Enrolling in Medicare Parts A, B, and D, or Medigap and or Medicare Advantage plan might provide you more coverage options than you have with your VA benefits, especially if you are far from a VA facility. But again, it's not required that people with VA benefits sign up for Medicare. It is a choice. And Medicare would pay for services not provided by VA benefits as long as you are seeking care through a Medicare approved provider or facility. So that would be something you would need to discern in advance. And while we're talking about this Medicare approved provider and facility, I want to take a moment to just step back and make sure that you understand that one of the key pieces of Medicare is that you have to make sure that when you go on Medicare and you want Medicare or Medicare Part D or supplemental coverage to pay for your health care, that you're going to Medicare approved providers. And further, what's really helpful is to make sure that those providers accept Medicare assignment so that you're not paying a lot of money on top of what Medicare pays them when you seek care. So it's important to make sure you're working with Medicare approved providers or facilities and that those providers and facilities accept Medicare assignment, okay? So now, just before we finish up, Tricare, another part of these military benefits. With Tricare, unless you meet certain exceptions, you do need to enroll in Medicare when you're eligible to remain eligible for Tricare. So Tricare works more like a supplemental plan to Medicare Parts A and B, a little bit different than the VA benefits. And just a bit on Medicare and the Affordable Care Act. So Medicare beneficiaries normally don't go through the Affordable Care Act exchange. You deal with Medicare Parts A and B, Medicare Advantage, drug plans, or Medigaps. You can purchase a plan instead of Medicare if you're paying a Part A premium, but get no tax credits. So if you get any tax credits at all, you can't do that. And Medicare beneficiaries can sign up for one of the dental or vision plans. Any Medicare beneficiary can sign up for those. Any one of the dental or vision plans that are offered through the Colorado Exchange of the Affordable Care Act at www.connectforcolorado.com. And I do know people who have Medicare Part A and B, they have a drug plan and they have a supplemental plan, but they have no additional vision or dental benefits. And they've gone to this website to find dental plans or vision plans or both that work for them. And a little bit on limited income and resource assistance. Not everybody can afford to pay or has the income or assets to be able to pay for Medicare Part B premiums. And some people have income that's low enough that they need assistance with their drug plan premiums, and also with supplemental coverage. So there are a couple of types of programs that exist. There are Medicare Savings programs. These are run through the state, and there are 4 different levels in these plans of income and asset dependence. And they help with original Medicare premiums, Part B, and they may help with some Part A too if you're required to pay for your Part A. They can help with deductibles and sometimes with co-insurance with Parts A and B. At the lowest income level, the Medicare saving plans work in tandem with Medicaid to provide supplemental coverage that way. There are also Part D extra help, the extra help program, which is run through Social Security. And this is the program that helps with Part D prescription drug plan costs. There are 2 different levels within this plan, and based again on income and asset dependence. And we as local SHIP counselors, again, can help with this piece as well, and are happy to do so if you give us a call. That's the bulk of everything I wanted to talk to in terms of a general overview of Medicare. I would like to go on and just give you a little bit more information about Medicare fraud and abuse before we close out. But are there any questions that we should be addressing at this time? Okay, then I'll move forward. Medicare fraud, what is it? Intentional billing to Medicare for services that were not received or for a service at a higher rate than is actually justified. The difference with that, with abuse, Medicare abuse, that's when services or products are supplied that are not medically necessary or that do not meet the professional standards that Medicare requires. In both cases, the results of Medicare fraud and abuse are millions of dollars that's spent detecting and investigating improper claims. Those can lead to higher premiums sometimes, medical identity theft, and has caused personal financial loss for those individuals who've been caught up sometimes in Medicare fraud and abuse. So things that you should watch for when you start enrolling and participating in Medicare. Watch for services or supplies that are not provided on a Medicare summary notice. Once you start Medicare, you'll get a Medicare summary notice every quarter that you've used, if you've used Medicare services in that quarter. And on that summary notice, you can check it against what actual services you had and what actual equipment you had, etc. Sometimes errors, though not intentional, will happen, and those potentially cost Medicare money, and that affects everyone. But every once in a while, those errors all were intentional, and you're being charged for something that didn't happen, a service or a product that didn't happen, or that you never got, or is being charged to you at a higher rate than it should be. So another thing to watch out for are providers who say, it's okay, you don't have to pay for it, Medicare is going to cover it. That's just a red flag, be on guard to make sure that they're not trying to oversell you on a product or a service. Also watch out for increases to cost for basic insurance coverage over and above what you think you should be paying. And then the last thing that I think happens sometimes is this, it's a term called upcoding. It's where a service that you got is being coded at a higher level or rate for a higher reimbursement to the provider, even though you received a lower code of service. So those are just some of the examples of things that you need to watch out for when you're addressing fraud issues. And it's important that you take a responsible, assertive approach and protect yourself. Treat your Medicare card and your Medicare number like you would a credit card. Watch out for identity theft. Be cautious of offers for free medical services. I have at times on my own phone been inundated with people trying to sell me medical services that may or not be covered by Medicare. And then you end up having to pay out of pocket for that. And never give out your Medicare number except to your doctor or other Medicare provider. And do be careful giving out personal health information over the phone. That is one of the best ways that people start their whole identity theft process on you, is through people who unknowingly share personal health information. So it's important that you watch out for phone, mail, text, and email scams. And please remember that Medicare is never going to ask you for your Medicare number, excuse me, unless you've initiated the conversation. Okay? Ways that you can detect fraud. Keep a record of your healthcare visits and cost, what services you had, what equipment you have, etc. And as I mentioned earlier, review that Medicare summary notice that you get and any other statements that you get on a regular basis. Read all the mail notices that you get very carefully. And please do not hesitate to ask your healthcare provider or the equipment suppliers for an itemized statement or an explanation of charges if something is not making sense to you. That is within your rights. And if you do feel that you have been subject to abuse or fraud, gather all the information and documentation that you can. Call the provider. You can call us and we can help you, or you can call directly to the Medicare Fraud line that's listed here. When you do all this, not only does it help to protect you, but it helps to protect the integrity of the Medicare program as well. So that's basically what I wanted to share with you this afternoon. I appreciate your time and attention to all that we've talked about. I want to let you know here that if you want more information, there are many ways for you to get it. You can go online to www.medicare.gov or www.socialssa.gov. They both have obviously a section on Medicare services and are good sites that can be well utilized. If you haven't already received your Medicare and You 2022 booklet and you think you're eligible for that, that is something that you can get through www.medicare.gov, or you can call the Medicare 800 line, which I'm sorry I don't have listed here. Oh, there it is, 1-800-Medicare. And you can request that booklet, especially if you're a person who doesn't like to use a computer too much. You can also use that 1-800-Medicare telephone hotline for any other information that you need about Medicare and Medicare health plans. Or again, you can call us for personalized counseling on all of your Medicare options, and we will be happy to assist you in wading through the maze of Medicare, as it has sometimes been called. And you can, if you're out in a different state and you need help finding people like ourselves in other states, you can go to the website, or you can call us directly here at 970-819-6401. So that's basically what I had to cover with you this afternoon. Again, my sincere thanks to Casey's Pond for sponsoring this for us. If you have direct questions about Casey's Ponds, those can be addressed by calling Melissa LaHaye at the number listed here, 879-8855. And with any time that we have left, I'm more than happy to take questions, which either I or perhaps Betsy or some of the others on the call can help to answer. Any questions anywhere? Okay. Well, thank you all very, very much for your time this afternoon. I hope you found this helpful. Again, please don't hesitate to call any of us if we can help you in any way.
Great. Thank you so much, Judy, for your presentation, and Betsy and Rebecca. I appreciate you all. And Rebecca, do we have a question over at the Senior Social Center? Is that?
I think we're good. I think they're just going to ask us the questions, but thank you.
Great. Great. Well, thank you so much, everyone, for attending. I appreciate it so much.
Okay, bye-bye.
Bye. Thank you.